Good afternoon to all. Today I'm going to tell you more about the secrets in Allen's keynotes, or rather I am going to focus on some hidden treasures in given by Dr. Allen's in his book Allen's Keynotes. So as we all know, in our practice, mostly the patient comes and our prescriptions are very successful on keynote indications, and that is the where most of the patients we in clinic we give on keynote. So here key is the keynotes is the key for success in your prescriptions to similimum. So these keynotes, as we are telling so much about it. This keynotes term in homeopathic world first coined by Dr. Gansi. He worked on that, and that's how the term keynote has come. So what is this keynote? Keynote of the remedy is the central idea which is running in the remedy through and through, or the central idea of that remedy. So we'll go ahead. This is the Gansi. You can see about him. He's the main one who has coined the keynotes and written his books on keynotes that everyone of us know about him. This is the keynotes I can show here. So these keynotes we are going to study today step by step with the application of it, with some case examples or some very important characteristics, clinical symptoms. So this structure of the keynotes is mainly on various different symptoms. It includes clinical symptoms, some constitutional symptoms, some strange peculiar connections between two remedies. But basically, these keynotes what we are reading today, or even we have read in college days, is the extraction of one very important source books, and that source books is hearing guiding symptoms. So I would like to correlate a story of Shabri, if you all are aware. So, when Ram was in the jungle and he visited one of his devotee, Shabri, so that time she has collected all the fruits for him, but she makes sure that all the fruits what she is offering to Ram is going to be sweet and not a bitter one. So that's why she has tasted it, and then after that she had offered to Rama. The same way, we are very much lucky that we have Allen's keynotes, because Allen has tested it, verified it clinically, and from the whole source books, 10 volumes of hearing guiding symptoms, he has extracted it in very concise form and given in the book Allen's Keynotes. So this keynotes arrangement is like this. The first line of the keynote is the most important symptom or the indication or the constitution of that remedy. So the first paragraph or the first line is the essential part of that remedy, and then after that you will see constitutional symptoms, then some pathophysiological symptoms, then some very peculiar comparison of remedies, then relationship of remedies, some tendencies like some pathological tendencies that remedy are known to form, or some very strange symptoms, some very strange mind symptoms, and the doses, how to give the dose. So it's really wonderful if we study keynotes in a very specified and a proper way. So the way, for example, in this slide you can read about it, a remedy which is known for the chronic ailments of women and tendency to miscarriages, especially at 3rd month. So we all know from our knowledge of materia medica and even studies of various books that which remedy comes in our mind for the tendencies for 3rd month, or the abortions, recurrent abortions for 3rd month. And the remedy is, as we all know very well, is Sabina. So you can open Allen's Keynotes and you will find the keynote. In keynotes, the first sentence what he has given is chronic ailments of women. So that means not only about the menstrual complaints, not only about the tendencies for abortions, but the women's chronic complaints or ailments which are there, and in that specifically about the abortions, the tendencies for miscarriages, and That way, if we read the Sabina, then we all come to know about the pathophysiology that he is able to develop, the bleeding and everything about it. So this way, we have to read every remedy with a particular purpose, or we have to read between the lines, and that read between the lines is the most important symptom or the thread which is running through the remedy. As we all know, materia medica, to remember all the materia medica or the symptoms of remedy is not easy and not possible, at least for human mind. So that way, we have to study a remedy with its correlation with pathophysiology, with the modalities and with the relationship with other remedies. That's how it is given. Now, a patient was there and the patient told that, doctor, I have one problem. What happened now? Suppose I am sitting somewhere or I am going somewhere or even I am doing anything. Some thoughts comes in my mind, and that thoughts comes and then I have to think about it. Then I think about it constantly, and then but the ultimate result is nothing. There is no conclusion of that thoughts, but it's just a plain thinking. I'm thinking about it, and I found it very strange symptoms, and believe me, it is not given in any repertory, and that's how I found sometimes the Materia Medica has given these symptoms as a very important one, but repertories fail to take it into the rubric form. And can anybody guess the remedy? This is from Alan's keynote because I'm talking about that only. So those have Alan's keynotes or have softwares, they can open the remedy, and the remedy name is physostigma. And the first line in physostigma that Alan has given, cannot stop thinking and thinks a lot. And this is the way I found it is now a fun for me to read these remedies again from Alan's keynotes or from any other books of Materia Medica, because now I can understand it in much better way, because I know what symptoms is important and what symptom is of that remedy in very prominent state. So, as we know, a very well-known remedy for contusion, injuries, mechanical injuries or some soreness, bruise feeling is the arnica. But in Alan's keynotes, he has given not only arnica, but along with the remedies in either in bracket or that means the another remedy that we have to think about it, or in the relationship he has given. So this is the first line of the remedy. That means this is the very important symptoms of that remedy, but generally we fail to use it in our practice or apply it in patients, because we know one remedy for only one complaint, but that is not the way. We have to read the remedy and correlate it with the pathophysiology, as I already told you. So this is from euphrasia. In euphrasia, the first line in keynote is given bad effects from that you all can read, bad effects from falls, contusions or mechanical injuries, and the similar remedy or the known remedy for that is arnica. So this way we have to study it, the first line of the symptoms. So my main purpose of telling about you, the first line is the very important in the keynotes, and that we have to know for sure. Okay. Then the next comes is constitutional. So Alan has given constitutional like a structure of person, the state of the person, age, body wise, how it looks, how it behaves in most of the remedies, but he has given it in very subtle manner. Like what happened now, a child had come, the child was very chubby, takes cold easily, even slightest cold things aggravate the complaints. The mentally is very dull, indolent, don't want to do any physical exercise, very indolent. And it was in my mind, I was thinking of a remedy, the well-known remedy that we all know for the indolent child who is chubby, fatty, don't want to do exercise, physical exertion aggravates, even mental. And the remedy, I was thinking of calcarea carb. But when I opened in Alan's keynotes, calcarea carb, I found it along with calcarea, one more remedy which generally we neglect, and that remedy is, can all read capsicum, and that is phlegmatic diathesis, lack of reactive force, and the same. But the capsicum was the remedy, which is again a very similar constitution as of calcarea, with the other concomitant complaints. So this way, I found it a very interesting constitutionals to study of every remedy, because if we know more constitution of the remedies, then we can think about that remedies. So then in lachesis, if we open, it is given in Allen's that better adapted for thin and emaciated or fleshy persons, and those who have changed mentally and physically by their illness. So that means a patient who was earlier very much fleshy, active, but after the disease, he has changed both mentally as well as physically. So he has written very beautifully that how the personalities gets changes after the illness or after the disease, and that's how we have to study it. As we know, lachesis with n number of symptoms, but generally we fails to recognize or fails to realize these kind of symptoms which are given very well in Allen's keynotes, but we forget it, or we forget to remember all that. The same way, the common thread, as I told you. So in keynotes, if you study a remedy in a proper manner, you will find the very common thread running between the symptoms. Either it can be modality, either it can be pathophysiology, either it can be the tendencies to forms, but these are all running through every symptoms. It can be either physical, it can be either mental, it can be fever, it can be general, it can be particular, or any disease pathology. But these modalities are there, and it is not altered due to any disease condition, but it's always there, and that's how we have to find, and we have to study very detailed, minute symptoms of the patient to identify a remedy or to identify a thread which is running between through the symptoms. Then in Allen's keynotes, it has given very strange symptoms. Strange as we studied mental as physical symptoms. So I would like to share one case. This is the case of a child. She is just 7-year-old. She had come to me for fever complaints. She was very bubbly child, always wanted to be with mother, want to hug father, and always be roaming around there, very sympathetic, likes to play always, likes to be in company. So, and with other fever totality, I found it the remedy which is very prominent was phosphorus. Though I gave phosphorus, it was relief, but not the complete one. It was again a relapsing state. So then I again restudied the case, and what I found, and what was the observation of mother, she said the child is very bubbly, very playful child, and goes to everyone and plays with them. But when she gets fever, she just don't want to be with anyone. She just don't listen, gets irritated, and wanted to be alone, like completely alone in a room. Don't want mother, don't want father. So I found this is a very strange symptoms, that the illness, before the illness and after the illness, the changes in the child is really a prominent one. But if you, I studied in definitely in repertory and all, but I failed to understand, because these symptoms are very difficult to understand through rubrics language, because the main essence of materia medica is not there. In few symptoms it happens. So then just I was thinking about the remedy, and this way I found it. I got the hint about it, and the phosphoric acid. And when I read the phosphoric acid mind from Allen's keynotes, and what it was written, that apathetic, that means the child was completely changed, those sympathetic, and after the disease is completely different. The apathetic, indifferent to affairs of the life. And the most important one, to those things that used to be of most interest. The child was liking for playing, to go and to meet people, and that has completely again after the illness is completely different. So the things that she likes of most interest, now she has complete aversion or complete apathy for that, and that's how I come to the remedy phosphoric acid, and which has given a good relief, no relapse of fever since last 6 to 8 months. She is doing really well. So I found it to study the mental picture of remedy worth, and if in keynote it is given a 3 mark, that means the symptom has to be there in the patient.